I saw dead bodies, and I think for 3 days I couldn't eat properly. Within like 5 minutes, this man shat on himself.
His ankle was literally dropping.
Wow.
Sorry.
Wow.
Trigger warning.
I hope cash is there.
Serious one. Biochemistry 200 level. You will shed tears if you don't cry. And if not, TEMISAN.
There was a time I was about to write pharmacology, and I was like, it's like I'm going to carry over this thing.
An agile lady, basketball. Let's go.
Oh my God.
Do you enjoy your journey throughout the university to this 500 level?
It has been a roller coaster, but then take it like that.
Me, I cried all the way here. My graduation day and convocation day, it will be cries of joy.
Wow. Imagine nurse we don't get job, we don't give you injection. How you go feel like, bro?
I personally won't tolerate that.
Today we are meeting 500 level nursing students. Final year, bro. You have to tell us why did they choose nursing and what are the various internships they have had and the experiences in the university. You know what I'm saying? And they will also tell us the quality of being a good nurse.
So you are in this engineering laboratory clothes.
We are with 2 beautiful nursing students. Final year. You know what I'm saying?
TOLU and a final year nursing student.
My name is TEMISAN, Adebiyi, final year nursing student, makeup artist, basketballer, entrepreneur, and everything you want me to be.
She's also a YouTuber, and I'm going to leave her link down below. You know what I'm saying?
So subscribe.
Tell me, son, what made you choose nursing?
Well, I was supposed to study medicine at first, and then it didn't work out because where the school I was supposed to go to, they had already closed their portal, so it didn't work out. And then my father, and I knew somebody that was in this school, so I was like, oh, did they have nursing or medicine? And then he was like, they had nursing, so I came to apply and I got in.
Wow,
that is very nice.
That's how you have interest, like that's how you have an interest.
Sort of. Like my mother is a medical doctor, so like regardless, if I was not doing nursing, I'd have still done something science related. Nursing was not like the ish thing.
Alright.
Personally, I didn't want to choose nursing. I wanted aeronautic engineering at first.
Wow.
I now later moved to like architecture. My dad was like, okay, why don't you try medicine? So I worked it out the first year. I didn't get it. I did prepare fucked me up. So and now my mom was not like, oh, that there's one school in Ondo that should come. So I came, I applied, and now I'm here. So it's not like I always had the interest for nursing. It was just like, should I say a last minute thing? If that makes sense.
Wow. That's last mind or last choice.
Last
something
resort. Because it was
Very
messing. It was aeronautic, architecture, medicine. And
nursing.
So, in your own opinion, do you think nursing is difficult?
it is.
It is difficult.
Yeah.
Nursing is very hard. You will cry. Like regardless of if you are doing engineering, medicine, MLS, I don't know, there's just something. I feel like it's because the work is a lot, and because the work is a lot, it's hard. It's not something you draw, nothing that you do everything. You will draw in nursing. It's possible you will sing, you will act drama in nursing, like everything. Yes, you will act drama, you will display, you are your patient's punching bag. Nursing is very hard, like, and it's one of the most disrespected courses. And it's also, yes, in Nigeria, like, we don't receive respect both from our colleagues and both from the patients. You still come back to school, like, it's very hard.
TEMISAN, do you think after nursing, is it possible to apply for medicine?
But what happened?
I don't know. It's kind of, you know.
I know some people. I have a friend that wants to do nursing, then she's going to go and do medicine. But personally, I don't see myself doing 5 years normal nursing. They're going to do 6 to 7 years medicine. Basically, spend like 10 years in medicine. I don't care. Like, you do like 10 years in medical school.
Wow.
So no, I don't see
With
myself
the
doing
trauma again. I cannot go through that stress again. It's going to even be worse because, like, I will now be thinking of, oh, should I specialize? Which part should I go to?
Yeah.
And stuff like that. When I've basically done, like, should I say like 60% of whatever they're going to take me in medicine, I've done it in nursing.
Nursing and medicine, they are two different things.
No, they are not completely different, but they are similar, but they are not completely different.
Yeah, because I was speaking to my mother because we're preparing for our nursing council exams, and then she was like, you don't need to learn this thing now. And I'm like, we're doing that. She was like, you're already a doctor. The medicine you're running away from, are you not doing it now?
Wow.
It's almost the same, just that we can't perform surgery.
Okay.
Doctors can perform surgery, and that's literally much.
Some people still say that the consultancy they can do, doctors can't do it, but then nursing practitioners do consultancy.
So there are inside nursing now. There are some departments to auxiliary nurses and other stuff.
No,
auxiliary
nursing
nursing
is not part of nursing.
Wow, it's just different parts.
Those are people that want to, should I say, workmanship.
Those people, like, they go to the hospital to try and learn from the nurses. They didn't go to school to learn.
Okay. Wow.
So Tolu, studying this nursing, is it a fulfilling experience, and would you love to choose another course if you are given it another chance?
After the period of studying nursing, will you still come back to nursing without any regrets?
I'll come back with regrets.
Okay, you choose nursing again with regrets.
No, I won't choose it. But if I had no choice, I'll come with regrets. But it's draining mentally. Mentally, to be precise, it's very draining. So no, I don't know.
I think the book also is bulky, right?
Yes.
So it's not like nursing and law. It's just like
tell me why I will have finished 200 level, 300 level, 400 level. I will not come back in 500 level to read those same things again. Yeah. Just because I want to write one exam.
Wow.
No, it's not just one exam. If that exam determines whether I just wasted my 5 years.
Yeah. Like nothing has been fulfilling in a way for me, because I've met a lot of people, like, in quotes, doing nursing. Also, like, sideways doing, like, being like a nursing content creator, if that makes sense, because I make some videos related to nursing and nursing vlogs. So, like, I feel like if I didn't do those things, I wouldn't have met the people that I have met now.
Do you deal with cadaver inside your practical, maybe human autonomy use a human being something?
For the cadaver, when we started nursing, like 100, 200, we were in the pandemic COVID situation.
2020.
Yeah, so we didn't touch the cadaver. We've seen, when we went to the hospital, we saw serious dead bodies. Trigger warning. I saw dead bodies, and I think for 3 days I couldn't eat properly. Because it's just flashback. Serious flashback of serious dead bodies. Look at it, they were burnt to ashes. So, like, and then they were like, they're going to be bringing cadavers to school, and mentally I was not just in it, but just people that I know, nursing students that have worked with cadavers. I feel like cadaver
300 levels.
Yes, and I feel like for me, cadaver is mainly for people that want to practice, like, surgery. But you can use it to learn how to do anatomy and physiology. But for myself, we didn't touch cadaver. Nursing, you can do so many things in nursing, and because of that, I know that I can do another thing and be better at it. Like, I know that if I can do medicine now, like, nothing, hands down, because what is 6 years in medicine and 5 years in nursing that I cannot do?
Yeah. You understand? 5 years. By the time we do internship is already 6.
So 6 years exactly.
We're more of textbooks and then like 3D diagrams of it, if that makes sense. So we not really deal with cadavers. It's mostly these 300, 200 and 100 of that.
Wow. Okay.
So, and Tolu, how prepared are you to become a registered nurse?
I don't know if you are talking about the exam. I mean, you are talking about in the workforce. For the workforce, I feel like, because I'm personally good at things like practicals and everything, so I feel like, okay, if I'm in the field right now, I know that, like, I would not say 100%, but like 70-80%, like, I'm ready. But then based on the exam, there's nobody that's fully ready for registered nursing exam.
Wow.
For the exam, I pity my enemies because our exams are literally next year May, and we have, like 200 level. Imagine covering. We did how many courses in 200 level?
I think 14.
Imagine covering 14 courses, 200, 300, maybe 12 per semester, all the way to 500, cover to cover. And you have to know this information, and you have to know this information before May. Just because we're going to do, is it 250 objectives?
Yeah, 250. It's not 250 one day, 250 another one. Paper 1, paper 2.
Paper 1, paper 2 plus practical. So you have
and
to
you still do your project.
You have a lot to read. So you can never be ready. You have to just pray for God or whoever you're worshiping to show you the place that you are supposed to read fast because it's not possible. Then it is for the workforce. I feel like I'm ready. We've done a lot of practicals, clinicals, practicals. Yeah.
Wow.
So I know how to, in quote, engage with people. I know where I want to specialize in already.
Okay.
So like I feel like I'm ready to be in the hospital. But for the exam,
Okay, now this I think is from the second person now.
okay.
She asked us to for you guys to share a memorable experience from a placement or internship you have had before that had a great significant impact on you.
Okay. I want to say like two. So the first one was in 100 level. I don't know why they thought that. How old was I? A 16 or 15-year-old should be placed in the hospital by that time.
During COVID period.
During COVID period. So in 111, I worked in FMC.
FMC in where?
Appriciate.
Okay, the annex.
Yes, the annex.
Okay.
So and then there was this patient that was hit by a bike, and I think he fell into coma, unconsciousness,
Wow.
and then they brought him in. Now, because I've read forward a bit, so I knew that even if a patient is unconscious, the patient will still have movements in their bowels as per they can still urinate, they can still like go to toilet and all of that.
Okay.
So I was like, Ma, sure you know your pampers for this person. And then she was like, no, don't worry, nothing's going to happen. And I'm like, so I said yes. I kid you not, within like 5 minutes, this man shat on himself. But I don't know how to cry and I was wondering how to pack it. After, he still did it again. And I could not eat. I cried that night. I called my mother. I told her I'm not doing it again. Why am I packing shit? Why am I packing urine?
And at 15.
Like, do you understand? And I know that I was so sad. Then my best memorable experience would be this 400 level clinical. I worked in the mental health hospital and I literally love all the patients there. I can't even like they love me, I love them. Like they are literally the best patients I have worked with. They can be very stubborn, but like maybe because it's just me, I'm just interested in mental health. I loved the whole experience.
My memorable experience was during the 100 level posting. So everybody it was chaotic. Well, to me, I was on top of the world because that was like literally my first time in the work field, like personally. And then I did it at FMC Owo, like Owo itself. It was there I knew that I had passion for family planning, the whole community health, sexual and reproductive health and everything. Yeah, it was from there I knew that I really wanted to go into it because like I observed some patients that were coming in. I noticed that they are not knowledgeable about their health. Not even just their health, their sexual and reproductive health, and they don't know that it also affects their mental health and their physical health. So like because of it gave me like this whole what they call the morale to actually go for the whole family planning thing. Let's see. And then one thing I hated too about it was it was during that period I realized that I have phobia for like open wounds, like big open wounds. They posted me for like a week at orthopedic ward there. And then there was one that had accident, like his ankle was literally dropping. Sorry. So as I saw it, I could not breathe. I was sweating from nowhere. And it was cold. I was sweating and I was literally trying to catch my breath. My chest was tightening. No, it was bad. It was from there. At the point I called my dad and I was like, Dad, I don't think that I can do nothing.
You started having some doubts.
Yes, if I see all this thing, just for 1 week, what will I not do during my lifetime when I'm seeing them? And then that was like another reason why I was like, okay, this family planning side. Last I will not see too much of injuries that big. Yeah, so like that's basically it. And then yes, this 100 level posting too was interesting. I really like mental health
Yeah.
because
Everybody loves
it
mental
was all
health.
fun, and she was like, I was so happy to the extent that I even created a whole Snapchat story
Wow.
to be recording my clinical experience.
Wow.
It was actually very fun, actually.
Wow.
A student in nursing too, so she has a question for you. She said, which qualification do we receive after nursing?
RN,
Yeah,
that is registered nursing. Then RM, which is registered midwifery.
Registered public health nurse, RPHN.
RPHN or RCHN,
Yeah.
anyone, yeah, that too. And then you have your bachelor's degree, normal.
Okay.
But for the registered nurse, you can decide to only. I think you can decide to only write that if you want to. I feel like the midwifery and then the
public
community
health.
health is not by fault, because personally, because of what I want to go into, I'm going to do the 3 exams. I feel like the qualifications depend on what you want to venture into.
After nursing now, what do you specialize on?
It's very easy. Mental health. I want to be a mental health nurse.
Okay.
If possible, I would like to become a therapist. If I can't do the therapist, because that's some ways human beings used to behave. You don't need to don't therapize them. I would want to be a mental health advocate, equality advocate,
A consultant,
women's
something
leader.
like that.
Not exactly. You know the people that work with like non-governmental organizations, people that like give talks, mental health, yes, things like that. But just a nurse in that aspect.
I hope cash is there.
Yeah. Serious one. What?
With the way people are going, mental health is going to be
Mental health
booming
is going
in the
to
next
be-
5 years.
People are turning crazy every day.
I'm planning to specialize in community health because of, and then I want to majorly focus on like the sexual and reproductive aspect of it. That's like family planning, literacy, the whole contraceptive use and everything. That's what I really want to specialize in, because I realize that even with the way people know about these things, they neglect it due to some barriers. So like I want to be able to make like I don't think I can make a total change in that, but like I want to be able to make a significant change in that particular aspect.
Yeah, in that community health and family plan. So like, what kind of change do you think that? What are kind of like ignorant things that people are always ignorant of?
One is the whole stigma from the society. When they hear, oh, okay, if I come here and I'm like, oh, I use a particular contraceptive method, the first thing that comes to their head, you're already having sex.
Oh yeah,
Okay.
Or out of wedlock. But we seem to forget the fact that, how will I put it, teenagers will always be teenagers. Adolescents will always be adolescents. Even if they say it in church, they say it in the community, they share flyers, they paste it on very big billboards. It will not still change the fact that even if some might decide to stop because of it, some will still want to venture into having sex and everything. And then due to this stigma, they won't want to, how will I put it, they won't want to open up and tell you, oh, I'm actually doing this, and then I need to protect myself from STIs. I need to be able to purchase contraceptives and stuff like that, if that makes any sense. So like the change I want to make is to have, I would like, with this confidence of accessing contraceptives and everything too. Yes.
Okay. So that's the kind of value you want to add.
Yes,
to the
that's what I want
community.
to add, and like try to eradicate all this cultural stigma and religious stigma too. Yeah.
People should just be people. No need to discriminate or segregate certain people, because that affects people's mental health.
Okay.
Increase in anxiety, suicidal thoughts, just because somebody does not like you for a particular behavior. And then also to be able to notice people that have like some certain type of, in quotes, mental abnormalities, even though being normal is exactly a social construct, but that's another story, by the way. But to be able to allow these people to speak up and have a place in society, because just because, in quotes, somebody have like a mental health problem like depression, does not mean that you should just throw them into a psychiatric hospital and forget about them. Like, these people still have space in the society. They can still cope and become greater things in society. So people need to like talk about these things and
encourage them.
Yeah, to just like tell people that mental health is not the end of the world.
So what are your most difficult courses while studying nursing? Of course there will be.
Hey my god.
There will be.
Let me start.
The one that is challenging, you know.
Biochemistry, 200 level. You will shed tears if you don't cry. And if not TEMISAN.
No, but I really like biochemistry.
Please!
I'm not joking. I really like biochemistry.
No, biochemistry is
because
so hard. Pharmacology,
Okay.
anatomy, physiology.
Just
Those four, I want to believe they are the hardest. There are other hard ones though, but you see those four, it's possible you can carry over those four every time.
wow.
You just be moving with it like that, just carry over.
Yes.
You will not carry over. But I'm speaking for others because you will cry. As I really need to just be bringing out tears because they are not understanding. These are not something that you can understand with first glance. You have to watch videos, go back again because you must not forget.
Yeah.
They are very easy to forget and they're very hard to learn. So
like before I knew the hemoglobin structure, now I don't even remember.
Exactly, because like pharmacology has to deal with drugs. You can imagine doing drugs for every system: the digestive, immune, mental health drugs, cardiovascular. Like serious, you be thinking that paracetamol, Panadol, vitamin C. They're not drugs, though. You've not seen drugs. Come to nothing. You've not seen drugs.
After you do that one, you still do this. You still try to treat side effects with
side effects of the drugs.
Can you mention one of those drugs, like one that's very long?
I'm a mental health skinny, so let me start with mental health drugs. So there's this drug, diazepam. You can give it to sedate a patient or to reduce the anxiety. Mainly, at the end of the day, they can try end up falling asleep. So diazepam. So you cannot give it to somebody that has cardiovascular problems. You can slow down their heart rate and they can end up dying. So like that's something that you have to look out for. For side effects, it's mainly sleeping can be the side effect or like prolonged sleeping. But then that's about it.
Weakness.
Okay. So Toby, which one is difficult for you?
It's pharmacology for me.
Wow. Only pharmacology?
No, I'm not finished. But it's pharmacology for me. It's ethic. There was a time I was about to write pharmacology and I was like, it's like I'm going to carry over this thing. It's like I'm going to carry over this thing because I'm reading this thing and then it's not sticking and I cannot just seem to relate it with whatever is going on around me at this particular moment. Because I'm this type of person, when I'm reading, I have to be able to relate it with whatever is happening around me. But,
so that you won't forget.
Yes, and then once I see like little reminders of those things that were around me during that period when I was learning it to, make me recall it and everything. But it was just so difficult for me. And then which other one? I feel like anatomy and physiology was just difficult because we did not have like a solid ground on it, basically. But then now that I've like decided, minus the fact that we are writing RN, so I've always like wanted to like treat like each system bit by bit. So like now that I'm treating them bit by bit, I'm appreciating the course and then it's better for me.
So guys, if you have any difficult or challenging subject, let us know in the comment section. You know what I'm saying?
Don't wait until the last minute to read.
Yes, absolutely.
Will I say somebody like me, I can try and get away with it. I work very well with, but when I'm pressurized, like I need pressure to be on my back majority of the time for me to do something. But if you're not that kind of person, I assure you will fail.
Wow. Even if you're that kind of person,
it's very possible that you will still fail because I don't know. Then focus on passing for school. Try and focus on passing your tests very well. Sometimes something that happens to the exam, you just be confused. Like the exam don't make sense, so you have to pass your test, do your assignments properly, because you need to keep up very high GPA, and then just try your best not to carry over. Resitting exams is a different type of mental health problem on its own. And then you pay money to receive those exams, do other things outside nursing. It might be hard, but it's better for you at the same time to try and venture, maybe do sports, maybe join a club, learn something, hairdressing, graphic design, at least one thing outside nursing, because it helps on your CV.
You're an agile lady. Basketball, let's go.
Oh my God.
I feel like you should not just focus only on nursing, because when you go out there you see other nurses too that are doing different things, and then you just be stuck with only nursing. Like for me now, I braid hair, I crochet, I basically do a lot of vocational stuff. I do graphic designing too. So like that helps me with networking. It helps me with networking. It helps me to keep myself busy. There are sometimes where that nursing part will not even be doing you to even touch. So you have the when you venture into other things, it gives you like a wider option of things to do. It does not just make you secluded in that old nursing thing. Because there are sometimes if you just focus on that nursing can fuck you up at any time. And even with the way people say, oh, they pay well, you can jackpot. What if they don't collect your visa? What if you end up not getting that the job that pays like what you are worth? Imagine you spending 1M or more than 1M per session, and then they are paying you like 200k per month. You have put all your focus into nursing. You are going to feel it. You will feel it bad.
I think OBJ, that's how even engineering too. I mean, last lecture that we had, they told us that it's not only engineering you have to do like other side hustles that was going to complement what you're studying in school.
Now the time that we are doing an orientation, our HOD said this himself that apart from this in engineering, like every single thing that they're teaching us in engineering, none of them is teaching how to make money.
I'm telling you,
none of them is teaching how to make money. None of them.
Actually,
so that is only an internship that maybe the skills you learn from it. Outside from that, all these book and pen something.
Especially in this Nigeria. Especially in this Nigeria. You better learn one entrepreneurship skill.
Just learn something.
Even if it's shoemaking, learn
if it's modeling.
People have big feet now, so they actually need people to construct their shoes for them, if that makes sense. Don't waste time. Don't say, oh, I'm going to do it tomorrow. I do it too.
Same.
I do it.
Very well.
I do it. But I can set timetable that, okay, tomorrow I'm going to read. And like today now, I said I was going to read from 5 to 7. I went to go and do a apropos at Boys Workout. But like, I would say like make time for it later.
Yeah, you sacrifice something to do that.
You sacrifice something to like meet up. Procrastination is very, very sweet.
Honestly, the bastard.
There's Netflix, there's Next Nigeria, there's Telegram. There are movies to watch, everything. So like, don't just postpone too much. You later feel it later. Like, imagine, focusing well and reading your 200 level courses well, and then you are in 400 and be 500 preparing to write your RN, and then you now have to go back to those topics that you didn't touch. Instead of it to be like a revision to you when you are doing it, it will be it's like you starting a whole lecture on your own again.
Exactly.
So like, don't postpone. Make sure you try to cover as much as you can, because it's very important. You can't cover everything; it's not possible. New things are developing every time, but then try to like cover as much as you can.
That's what they told us in my internship too, because those people teaching us. I went to automotive industry in Elizade University. I hope you see the video. You saw the video?
Yes, I did.
Okay. I went there and they taught us many different type of technologies in cars. And they told us, guys, whenever, like in 5 years time now, you want to compare the technology of now and then. So them now, they are learning as new one is coming, they're also learning it. So do you enjoy your journey throughout the university to this final level?
It has been a roller coaster, but then take it like that.
I cried all the way here, and I've got here, and I will cry, and I will graduate.
Anatomy, so on their level.
I cried all the way here. I will cry as I'm going, but on my graduation day and convocation day, it will be cries of joy.
Wow.
So that's what I know. That's a period.
Thank you guys for watching this video. Hope to see you in the next one, and comment the next department we are going into. We are going for, I think, mechanical, right?
If you have any questions, please comment.
Let's know it down below.
In comments.
Don't forget to like, comment, and subscribe, and they'll see you in the next one. Bye.